This morning on CT21, as COVID concerns increase, Governor Lamont announces that a Yale epidemiologist is his pick to lead the state's health department. Dr. Manisha Juthani joins us this morning. George Logan, who served on the state level, now has his eye on Washington and the congressional seat currently held by Jahana Hayes. He's talking about what he wants to do for the people of the 5th District. And how you can help a group dedicated to helping Connecticut's veterans without even leaving your home. It's all ahead this Sunday morning, August the 1st. CT21 starts right now.
From Channel 3, this is Connecticut's most watched current affairs program, CT21, with Eric Parker, sponsored by Hartford Healthcare.
Good morning. Welcome to a brand new month and a brand new edition of CT21. We begin this morning with the nomination of Dr. Manisha Juthani to head the state's Department of Public Health. And making that nomination earlier this week, the governor cited her expertise as a specialist in infectious diseases as one benefit to the state in this new role. Dr. Juthani is joining us this morning. Thank you for being with us. Your resume is super impressive. UPenn, Cornell, Yale, a New York Presbyterian for your residency. Why Commissioner of the State Department of Health, Dr. Juthani?
Well, first of all, thanks so much for having me. And I would tell you that I've dedicated my life to helping to care for the population and battle infectious diseases, and have advocated for public health in every role that I've had in the research I've done to protect nursing home residents. And the opportunity to serve as commissioner in our great state is an opportunity to address public health at a level that you just can't do in academia. So why did I say yes to this offer? Is because it's an opportunity to address all the important issues of public health, of which COVID is a preeminent one at the moment, but there are many others, and it's an opportunity to serve, which is something I never really thought I would have had an opportunity to do.
And also the opportunity to be our state's first Indian American commissioner, which I know is a big deal as well. As I did some research in preparation for interviewing you, a lot of articles in India publications about your nomination. So people all around the world taking notice. There's 700 employees at that department, $150 million budget. I know you have the background in the medical field, but you're also going to be an administrator in this role. What do you think about that part of the job?
So, first of all, I have led large grants, clinical trials that have been of several $1 million, and have had staff that I had to work with and be able to manage in terms of being able to do those aspects of my current job. Even as an academician, I've had administrative responsibilities that are certainly large. This will be a leap. I don't doubt that. But I think some of the same principles that you use in other aspects of life can be applied to this. And as well, I'm being brought in under the leadership of Dr. Gifford, who has had significant experience not only at DPH, but at DSS as well. And I look forward to her mentorship to be able to help me navigate the aspects of this job that I don't have as much experience in.
Now, one thing you do have experience in, it's in advising the governor about COVID. You've been doing that since before this nomination. And one thing many people noted after you were nominated was that in the early stages of some of the lockdowns, you pushed a little harder for a more conservative approach. The governor didn't take all your advice on everything. How do you see your interaction with him going forward if you disagree with something he wants to do or doesn't want to do?
I feel that my first introduction on a personal level to the governor was when I was with a group of doctors that in the surge of this pandemic were advising medically against indoor dining because it was one of the things we were seeing as a risk factor. Going forward, we are in a very different place in Connecticut now. We have vaccinations that have topped one of the most in the country. And what I have noticed with the governor is that he likes to bring different voices to the table. I will continue to advocate for public health and for the health of the citizens of Connecticut. And at the end of the day, he, as our governor, has to make choices and decisions that balance all the different needs of the state. We have a very nice working relationship, and I look forward to being another voice at the table when he has to make these difficult decisions.
And we obviously have you on today because you've just been nominated, but you're also such an expert in such a big topic right now as far as infectious diseases and COVID. We've heard so much over the past week about these changes and do you need a mask and don't you need a mask? And I just want to ask you this question from your expertise. As someone who's vaccinated, if people are telling those folks to go back and start wearing masks again, Isn't it not because of any behavior the vaccinated person has done, but rather because unvaccinated people can't be trusted to just wear them on their own? How are you supposed to take that if you're told to put the masks back on?
I think, first of all, you're absolutely right that the unvaccinated group is driving the pandemic at this point. So you are much more at risk, significantly more at risk if you are unvaccinated. And your chance of getting COVID is, again, much higher from unvaccinated to unvaccinated person. Having said that, we are seeing small portions, and it is uncommon, but we are hearing about it, about breakthrough infections in those who are vaccinated. The other thing that we're seeing with the Delta variant is it does seem that the viral load, the amount of virus you might have in your airways, in your nasopharynx, might be higher than it was with other variants. So one of the concerns there is that even if you get a mild case or even an asymptomatic case of COVID, if you are vaccinated with the Delta variant, is it possible that you might be able to transmit it to somebody else? And it looks like the answer is yes. So even though that other person may have a mild form of the disease or even be asymptomatic, if you're around somebody who's older or immunocompromised, it's possible that they get a more severe form. So what is my take on this? My personal feeling is that the people in Connecticut have been very good with masks overall. It's not been that big a deal. And actually, masks allow people to continue to live their lives. So if you're going into a crowded place, what is my personal approach is that if I want to go and live my life and do some of the things that I haven't been able to do in the past, I keep my mask with me. And if I feel more comfortable putting it on because I don't know who's around me and I don't know if they're vaccinated or not, I just put my mask on. And that's just my general approach. I think a lot of people have COVID common sense at this point, and a lot of people can just make those judgments for themselves.
All right. Well, that broke it all down for us. I appreciate that. I want to ask you something about being an administrator. Dr. Scott Gottlieb, who has been advising so much in this whole issue, said this week on CNBC that the CDC is likely to have good analysis on the Delta variant in about 4 months. And he said, we need to be faster. We need to not be looking retrospective. You're now leading an agency and can do things in real time. Do you think that's important, that we kind of get this health monitoring up to speed?
That would be an aspirational goal that I absolutely would like to be able to see happen. We have to remember that public health has been brought into the limelight because of a crisis. However, over decades, public health has been eroded in terms of the amount of funding that goes towards it, because when people don't see a crisis, they don't see what public health's importance is. So I would very much like to do that, and certainly for our state and at our state level to be able to generate data like that in real time. The problem is going from where we started to that goal of what Dr. Gottlieb mentioned is going to take some time. And coming into this role, that is absolutely something that I would like to be able to see accomplished. It's going to take teamwork. It's going to have a close look at the funding that we have to date and what is going to be sustainable funding over time, not just one-shot funding to take care of an immediate crisis. And those are some of the challenges I look forward to being able to delve into and really answer in the months ahead.
All right, Dr. Manisha Juthani, the nominee for Commissioner of the Department of Public Health. Something tells me we're going to be talking to you again on this program, Doctor. Thanks for being with us on this Sunday morning.
Thanks for having me, and happy to be back.
Later in our program, a way for you to help Connecticut veterans. But up next, he's running for the 5th District congressional seat, currently held by Representative Jahana Hayes. George Logan is joining us when we come back.